I think I was developing mental health issues and anxiety as a young child. I was sexually abused and raped. Some of it happened before I was 18 months old. So I ended up seeing a psychiatrist when I was 10. He suggested I go into hospital, which was a big mental asylum. I was there as an inpatient for about 9 months. If you got a tiny bit upset, they would sedate you, they would strap you down. They would inject you with a sedative. I was only doing school for half a day, so I found it very hard to fit in at high school. And I got put into care when I was 12. You were treated like a number, not a person. I think I was moved about 20 times when I was in care, from one children's home to another. I ran away a lot. I would sleep on the streets because I felt safer on the streets than I did in the children's homes. A lot of the girls that were in care have died since by suicide or drug overdoses or alcoholism. I left care. I was put into a third floor bedsit. You're left to just, okay, have a good life. I was scared on my own in the bedsit. I took in lodgers, just anybody. My flat was like a doss house. People would just come and stay. I was in a violent relationship with my partner. He was abusive mentally and physically. I'd not had the guidance. I didn't have self-worth. Nobody had instilled in me that I was okay. When I was 27, I had a breakdown. I was in hospital for 2 weeks. It was more of a breakthrough. I didn't know I was ill. For all those years, I didn't know I was not emotionally regulating properly. I had a really good community psychiatric nurse. She was amazing. She really helped me fight for support with my son. Things started to level out because I had a person there that was reassuring me if I thought I was doing the wrong thing or I was unsure of what I was doing. I think through the CBT and the dialectical behavioural therapy, the DBT I had in 2019, that really has helped me to deal with life better. I was introduced to the Wales Mental Health and Wellbeing Forum. The knowledge within that group is amazing. All the things they fight for and the passion within people. I was actually really surprised at the impact it does have. We have that direct link with the Welsh Government. A few members have helped put together mental health strategy for Wales with the Welsh Government. And now that's been published and translated into Welsh and it's going to be pushed to all the health boards. I mean, that's massive. I always feel quite pumped up and motivated when I come away from quarterly meetings. I think, you know, if you can try and help someone, then your day's not been wasted.